The classic model of speech therapy is once or twice a week in an office for 50 minutes, 50. That's kind of the classic. Another model that the more practices that take insurance are based off of is a 30-minute session. So once or twice a week, sometimes 3 times a week, for 30 minutes. So it's a 30 or a 50 usually. It often involves parents bringing children to a center. Now, since COVID, everybody has been closed. And so many centers, that's not true, actually, that everybody has been closed. Many centers have been closed. SpeechKids was always an itinerant practice, meaning we did not have a center. We went to you.
We were never office-based.
We were never office-based. So
we only worked with kids in their homes and schools and daycares.
And now, since the pandemic, we have been 100% virtual. And we are continuing to be, for now, as of the recording of this interview, 100% virtual. But what that allows us to do is play with time and frequency. So because you're not getting in your car to come to us, and because we're not getting in our cars to come to you, we can do things like see a 2-year-old 3 times a week or 4 times a week or 5 times a week for 10 or 15 minutes. And the thing that's really awesome about that is that when we do these short sessions, we're all in for that amount of time. In a 50-minute session, I'm going to have to take several breaks because a 2-year-old, for example, does not have the attention span. And we're keeping it always play-based. And actually we'll do a longer question about play-based therapy in a second. We're always keeping it play-based. We're never doing worksheets, almost never. We're not like focused on sitting and like focus and like work and all the things. But in a 15-minute session, I'm going to have to take several breaks. If we do a 10-minute session every day, I am going to have the child sitting in a chair where they can't run around. Oftentimes that's the high chair because it's a great contained space that they like because they get food while they're there, right? And we bring some toys. So your child is going to play with their toys. I'm going to play with my toys on my end. We might pretend to exchange, right? But we can get really into it for 10 minutes and then we're done. And right about the time that your child wants to get up and walk around, speech therapy is finished and we get to do it again tomorrow. So that virtual nature has been actually kind of a game changer for the little kids, which I was not at all expecting. And it is a powerful new tool that I feel like I am delighted to be using. And the thing about it is the kids make so much progress because we've got that daily repetition and that drip and that practice. And it's been fantastic. So that has been really exciting.